Hi, I'm Orly Stamper. I'm a PhD student at University of Washington in the Department of Environmental and Occupational Health. And today I'll be talking about developing a method for local health jurisdictions and schools in Washington to use low-cost monitors for wildfire smoke preparedness. And I'm working on this project with Julie Fox from Washington Department of Health and two of my advisors at University of Washington, Catherine Carr and Edmund Cito. So I think we all know that wildfire smoke is anticipated to increase in frequency and severity, and will be more likely to overlap with the school year. Um, while indoor environments do offer some protection from wildfire smoke, PM 2.5 can still enter buildings. So this is a concern for schools and local health jurisdictions, and they're looking to state agencies for guidance on this issue. So in Washington, the Department of Health convened a group called the Wildfire Smoke Impacts Advisory Group, and one of their aims was to develop school activity and closure guidance, which they did, and it was based on indoor PM 2.5 concentrations. But they acknowledged that we don't actually have a set protocol for assessing indoor PM 2.5 in schools. And so that motivated the advisory group to embark on a pilot study to start to address this issue. So one of the questions motivating the pilot study is how does PM 2.5 concentration differ within a school during wildfire smoke or other high particulate matter periods? So would we expect the concentrations in a portable to be the same as a classroom that's connected to a main building HVAC system or a gym or a library? Two other questions motivating the pilot study were, can low-cost sensors be used by school and local health personnel to establish reliable estimates of indoor-outdoor ratio? And can that ratio actually be a reliable indicator of infiltration? And this figure on the right is showing different ways that outdoor particles can enter indoor environments, and also indoor particles can come from indoor sources. So the main idea behind the pilot study was that if schools could estimate their indoor-outdoor ratio of PM 2.5, and if that ratio was a reliable indicator of infiltration, they could take that number and multiply it by the reading of the closest regulatory monitor to the school to estimate indoor concentrations, or they could multiply it by an outdoor PM 2.5 forecast to forecast indoor concentrations. So we acknowledge that there are a lot of questions associated with this approach, but the goal of this pilot study was just to establish a jumping off point, somewhere to start. So the advisory group worked with 3 local health jurisdictions who worked with 5 schools total to set up 1 stationary indoor sensor and 1 stationary outdoor sensor for 1 to 2 weeks. And those are actually purple air monitors. And then they also did a walkthrough of the school. They spent 5 minutes, about 5 minutes per classroom or area of the school, holding a portable Dialos monitor. For the analysis, they looked at the variation between different classrooms and areas in the school. They compared indoor and outdoor PM 2.5 sensor readings. They compared the outdoor sensor to the closest regulatory monitor, and the advisory group got some preliminary feedback from the local health jurisdiction personnel they worked with. So here are some preliminary results. This table is showing the maximum variability between areas at each school that participated in the pilot study. And the results shown are based on 5 1-minute measurements in the different locations at each of the 5 schools. So the left column is showing the location with the highest PM 2.5 concentration. Then the next column is showing the location with the lowest, and then the third column is showing the average fold difference. So for example, in school number 1, The PM2.5 concentration in the portable classroom was 5 times higher than that found in the gym. So I thought these differences were meaningful, even though they are based on very few measurements. In comparing the outdoor low-cost sensors with the closest regulatory monitors, they found that the sensor tracked really well with the monitor, but overestimated PM2.5, particularly when the outdoor levels went above 20 micrograms per meter cubed. And then looking at the indoor-outdoor ratios for 4 schools, they ranged pretty widely, which was somewhat surprising to me because they have very similar filtration levels, those 4 schools. So we had 5 overarching questions arising from the pilot study. One is, does the low-cost sensor data need to be calibrated or corrected to be useful in this context? And I will talk about that more in the next slide. The second is, how does the indoor-outdoor ratio vary over changing outdoor particulate matter? So if the idea is for schools to be able to do this testing during typical air quality and apply it to periods of wildfire smoke, is it safe to assume that the ratio found during typical air quality will be the same or similar to the ratio found during wildfire smoke? And then 3, what's the impact of indoor generated particulate matter on the ratio? 4, how many measurements are necessary to reliably estimate variability between the classrooms? And then 5, how could school and local health personnel use this data to make decisions about school activity and or filtration needs? So the preliminary feedback was that the schools were enthusiastic about this protocol and local health jurisdictions were enthusiastic about the protocol, but didn't actually feel comfortable using this data to make decisions. So I wanted to start by addressing some of the calibration issues. So one, we would expect varying particulate matter composition between typical and wildfire periods, and that would impact the calibration models. 2, we would expect varying PM composition between indoor and outdoor air, especially if there are a lot of indoor sources of particulate matter. 3, we would expect to see varying temperature and humidity conditions between indoor and outdoor, and also between typical and wildfire smoke periods, which will impact sensor readings. And 4, we might expect to see varying conditions and PM composition between the school area and the regulatory monitor location, especially if they're not very close to each other. So I want to start addressing that second question, how does the indoor-outdoor ratio vary over changing outdoor particulate matter? And so I did that by looking at data that was associated with a paper published by Pantelic, Daw, and Lucina 2019. So they collected indoor-outdoor data over periods of typical air quality and wildfire smoke in 2 buildings, one that was mechanically ventilated with a high level of filtration and the other naturally ventilated. So I plotted the indoor-outdoor ratio over the outdoor PM2.5 concentration. And for the mechanically ventilated building on the left with the blue dots, I found that the median ratio during typical air pollution was 0.01, but during wildfire smoke, it went up to 0.24. And then on the right with the green dots is the naturally ventilated building, and I found the median ratio during typical air pollution was 0.39, but during wildfire smoke, it was 0.65. So this suggests that it might not be a safe assumption that the ratio found during typical air quality could be applied to wildfire smoke. So that'd be something to look into more. I wanted to start looking at this question in data that we've collected as well, although it's really hard to compare this slide to the previous slide because we just didn't see very many hours of high particulate matter. So I just compared the indoor-outdoor ratio when the outdoor PM2.5 was lower than 20 micrograms per meter cubed versus higher than 20. So in the school, the blue school shown on the left with the blue dots, I found that there wasn't a big difference between the ratio above or below 20 micrograms per meter cubed. But in the purple school on the right with the purple dots, the ratio actually went down for the higher outdoor PM. But again, it's really hard to take a lot of meaning from this slide because we just didn't see very high PM levels. So we have 4 main objectives for a follow-up study to build on the pilot study. So the first is to develop a recommendation for using walkthrough sampling to estimate variability between classrooms in the school. The second is to evaluate how indoor-outdoor testing done during typical outdoor particulate matter concentrations can inform infiltration during high particulate matter episodes, so the questions that I was just talking about. The third is to develop an acceptable procedure for local health and school personnel to conduct to gain meaningful information on expected infiltration and variability within the school during high particulate matter periods. And lastly, our goal is to produce data that people are comfortable using to make decisions about school activity restrictions and air filtration needs. For the follow-up study, we're planning to collect long-term indoor-outdoor data at 2 schools in areas that we expect to be impacted by wildfire smoke. So we'll have 2 purple air monitors co-located outdoors at the school, and then 8 indoors in different classrooms and areas. We're planning to collect data over about a 6-month period that includes the wildfire smoke season. And to address some of those calibration issues that I raised, we are planning to co-locate all of the purple air monitors indoors and outdoors with gravimetric samplers for short-term periods. And then we're also planning on using a particle size analyzer for short-term periods to get a better idea of particle size distribution, because we think that'll play a big role in the changing indoor-outdoor ratio between typical air quality and wildfire smoke. To address the question of variation in indoor-outdoor particulate matter between rooms within a school, we're planning to compare the long-term stationary data that we collect from the purple air monitors to small samples of that stationary data, of that long-term data, that represent hypothetical walkthroughs through the school with a handheld sensor. And this figure is just showing a schematic of the school air sampling. The purple dots represent the purple air monitors in each of the different classrooms, and then the blue dotted line represents a hypothetical walkthrough with a handheld sensor. And I'm obviously not an architect, sorry. And then we also want to compare those findings of the variability between different rooms during typical air quality compared to wildfire smoke to get an idea, again, of how testing done during typical air quality can be applied to wildfire smoke. We're also planning to have discussions with the school and local health personnel who are involved in this protocol to learn more about their ideas and experience. So we'll be focusing on questions around feasibility, decision-making, confidence in the data, data interpretation, and implementing changes. And we're planning to, based on our findings, develop multiple different protocols that schools could potentially use. We will update those protocols based on the feedback that we receive, and then test them in 2 additional schools, and then we'll further refine based on additional feedback, with the end result being 2 different protocols that are informed by the direct experience of 4 schools and feedback from the advisory. So I just want to emphasize, again, this is a work in progress. I definitely welcome your questions and feedback. Please feel free to email me any questions or comments. My email is here, ostamp@uw.edu. And thank you so much for listening today.